Did you know that more than 537 million people worldwide live with diabetes? According to the International Diabetes Federation, this number is expected to exceed 780 million by 2045, and the elderly represent the majority of this growing statistic. Despite this, there is a myth that still confuses many people, that those with diabetes need to completely eliminate fruits from their diet. This idea, besides being mistaken, can further harm their health. What many don't know is that there are sweet, accessible, and common fruits that, when consumed correctly, can help control diabetes and contribute to overall health. If you are over 55 or care for someone in this age group, this video is especially important. We will present 5 sweet and safe fruits that not only can be consumed by diabetics but also help stabilize blood sugar and prevent complications. You will learn which fruits these are and how they work in the body, how to consume them correctly to avoid sugar spikes, and what common mistakes the elderly make when including fruits in their diet. If this information is useful to you or someone in your family, subscribe to the channel, turn on notifications, and share this video with those who need it. Your care can make all the difference. Now, let's get straight to the point. Is the sugar in fruits really a problem for those with diabetes? The truth about fruit sugar. Many people with diabetes fear consuming fruits because they contain sugar. But what not everyone knows is that the sugar in fruits is different from the refined sugar found in sweets, sodas, and processed products. The natural sugar in fruits is called fructose. When consumed in small quantities and with the fruit's natural fiber, it is absorbed slowly by the body. This avoids dangerous blood glucose spikes for diabetics. Additionally, fruits are rich in fiber, vitamins, antioxidants, and minerals, components that help improve cardiovascular health, protect the kidneys, reduce inflammation, and even strengthen the immune system, which is essential for elderly diabetics. However, context matters. The problem isn't fructose itself but how it's consumed. For example, when fruit is juiced without its natural fiber, the fructose is absorbed quickly, causing a sudden rise in blood sugar. The secret lies in balance and how you consume it. Eating the whole fruit, with the peel whenever possible, and chewing slowly makes all the difference. In the next chapters, we'll reveal 5 sweet and common fruits that, contrary to popular belief, can help fight diabetes naturally and effectively. Common mistake: cutting out all fruits. Upon receiving a diabetes diagnosis, especially in older age, many patients, and even some outdated healthcare professionals, react drastically, cutting out all fruits from their diet. This well-intentioned approach is a serious mistake. Completely eliminating fruits can deprive the body of essential nutrients like vitamin C, potassium, flavonoids, and soluble fiber, which play important roles in blood sugar control, heart health, and digestion. Moreover, overly restricting the diet may lead the elderly to replace fruits with processed low-sugar products high in chemical additives, dyes, and sodium, posing an even greater risk for those with chronic conditions. Another issue is the psychological impact. Extreme restriction can cause anxiety, binge eating, or even abandonment of nutritional treatment. Remember, it's not the sweetness of the fruit that defines its impact on blood sugar but its glycemic index, fiber content, preparation method, and dietary context. In other words, it's not about cutting out fruits but choosing wisely and consuming mindfully. In the next chapter, we'll introduce the first sweet and safe fruit that can be part of an elderly diabetic's diet, and it might already be in your fruit bowl. Fruit 1. Apple. The apple is one of the most recommended fruits for diabetics, especially the elderly. It's sweet, practical, easy to find, and, most importantly, helps control blood sugar levels. The secret lies in its high soluble fiber content, particularly pectin. This fiber forms a gel in the intestines that slows glucose absorption, helping maintain stable blood sugar for longer. This means fewer spikes and crashes, which is crucial for type 2 diabetics. Additionally, apples have a low glycemic index, especially when eaten with the peel. This means they release sugar slowly into the bloodstream, ideal for the elderly's more sensitive metabolism. But the benefits don't stop there. Apples are also rich in antioxidants like quercetin, which reduces inflammation, protects the heart, and even improves insulin sensitivity, a critical factor for diabetics. Another plus, apples require chewing. This promotes satiety, aids digestion, and prevents overeating. The recommendation is 1 medium apple per day, with the peel, raw. Avoid juicing or cooking with sugar, as this alters its composition and may increase its glycemic index. Simple, tasty, and functional, the apple deserves a permanent place in any elderly diabetic's diet. Next, we'll discuss a fruit many overlook but is a true champion for glycemic control. Guava is one of the most powerful fruits for diabetes control, and, surprisingly, it's still underestimated by many. It's naturally sweet, appealing to the elderly palate, but has a low glycemic index, meaning it doesn't cause rapid blood sugar spikes. This is due to its high soluble and insoluble fiber content. A single medium guava can contain up to 5 grams of fiber, an excellent amount for glycemic control and intestinal health, another critical issue for the elderly. But the benefits go beyond fiber. Guava is a vitamin C powerhouse, with up to 4 times more than oranges. This strengthens the immune system, fights inflammation, and protects blood vessels, essential for long-term diabetes management. Another highlight is lycopene, especially in red guava. This antioxidant protects against cardiovascular disease, reduces oxidative stress, and improves endothelial function, supporting blood circulation, vital for elderly diabetics. The ideal way to consume it: eat the whole guava with peel and seeds, well washed. Have it for breakfast, as a snack, or in small portions throughout the day. Avoid processed juices or packaged versions, which lose fiber and increase sugar concentration. Natural, nutritious, and accessible, guava is a valuable ally for safe diabetes control. Next, we'll discuss a fruit few remember is a fruit, and one that can revolutionize metabolic health. Fruit 3, avocado. Yes, avocado is a fruit, and one of the most powerful allies against diabetes, especially for the elderly. Unlike most fruits, avocado is low in sugar and rich in healthy fats, particularly monounsaturated fatty acids. These fats improve insulin sensitivity and reduce triglycerides and bad cholesterol, factors often linked to type 2 diabetes. Another key point is its high fiber content. A 100-gram serving of avocado provides up to 7 grams of dietary fiber, slowing digestion and carbohydrate absorption to prevent post-meal blood sugar spikes. Avocado is also rich in magnesium and potassium, essential for cardiovascular health, blood pressure control, and muscle function, all sensitive areas for the elderly. Its versatility is another advantage. It can be eaten plain, with lemon, mashed on whole grain toast, or even as a base for sugar-free healthy desserts. But beware, though healthy, avocado is calorie-dense. The ideal is 2 to 3 tablespoons per day, preferably at dinner or as a snack. Always consume it naturally, without added sugar or condensed milk. Avocado proves that not all fruits need to be sweet to help control diabetes. For the elderly, it also provides satiety, quality energy, and cardiovascular protection. Next, we'll discuss a sweet, juicy, and often forgotten fruit that can work wonders for blood sugar. Sweet, refreshing, and easy to digest, the pear is an ideal fruit for elderly diabetics. Often undervalued, it deserves attention for its balanced nutritional profile and metabolic benefits. Pears have a low to moderate glycemic index, meaning their fructose is absorbed slowly, avoiding dangerous glucose spikes. One of its biggest strengths is its high soluble fiber content, especially with the peel. A medium pear provides about 5 grams of fiber, promoting gut health, satiety, and slower glucose absorption. Pears are also rich in vitamin C, potassium, and natural antioxidants, which reduce inflammation, protect blood vessels, and improve cardiovascular health, critical for diabetics. Another benefit is its high water content, aiding hydration, often neglected in the elderly. Dehydration can worsen blood sugar and kidney function, already vulnerable in diabetics. The recommendation: 1 medium pear per day, with the peel, raw, and well washed. Avoid canned or syrup-packed pears with added sugar. Simple, accessible, and safe, the pear is more than a healthy snack. It's a natural remedy in the palm of your hand. Next, we'll introduce the 5th fruit, a small but mighty ally for gut and blood sugar health. Fruit 5. Plum. Small in size but huge in benefits, plums deserve a spotlight in an elderly diabetic's diet. We're not just talking about dried prunes. Fresh plums are also powerful for glycemic control. Plums have a low glycemic index and are rich in soluble fiber, slowing sugar absorption and stabilizing blood glucose, key to avoiding dangerous fluctuations. Plums are also known for regulating digestion. Constipation is common in the elderly, and good gut function is essential for nutrient absorption and glycemic balance. They're also packed with antioxidants like polyphenol and vitamin C, fighting free radicals and inflammation, common in type 2 diabetes. Dried plums, prunes, can also be eaten in moderation, without added sugar or preservatives. Due to their concentrated nature, limit to 2 per day, paired with protein or fiber to reduce glycemic impact. Plums are surprising, tasty, practical, and beneficial for both digestive and metabolic health. Next, we'll discuss how the elderly can safely and strategically consume sweet fruits without compromising blood sugar. Safe consumption tips for the elderly. Choosing the right fruits is just the first step. The real impact on diabetes control lies in how they're consumed, especially for the elderly. Metabolism slows with age, and many seniors take medications affecting nutrient absorption or pancreatic function. Thus, fruit consumption requires safe, effective strategies. First tip: avoid eating fruits alone, especially on an empty stomach. When consumed solo, fructose enters the bloodstream faster. Always pair fruits with protein or healthy fats. For example, apple with natural peanut butter, pear with a piece of white cheese, dried plum with a few nuts. These combinations lower the meal's glycemic index and stabilize blood sugar longer. Another key tip: control portions. Fruits are healthy, but excess, even with low glycemic options, can disrupt glycemic control. For most elderly diabetics, 2 to 3 daily servings, spread across meals, are ideal. Finally, chew well and eat mindfully. Slow chewing aids digestion, improves satiety, and supports post-meal glucose control. These small changes make a big difference in practice and are easy to adopt daily. Next, we'll highlight a serious mistake many still make. Serious mistake: juices and processed fruits. A common and dangerous error in elderly diabetes management is replacing whole fruits with juices or processed versions. Though seemingly healthy, this can seriously disrupt glycemic balance. Juicing removes most of the fiber, which slows sugar absorption, while retaining, and often concentrating, fructose. For example, a glass of orange juice may equal 3 to 4 oranges worth of sugar, with no fiber to balance it. Result? A rapid, dangerous blood sugar spike, causing fatigue, dizziness, blurred vision, and, long-term, contributing to complications like neuropathy and retinopathy. The problem extends beyond juices. Canned fruits in syrup, frozen pulp with added sugar, candied fruits, and even some homemade jams may seem natural but contain high doses of simple sugars, preservatives, or artificial sweeteners that strain the liver and pancreas. Elderly diabetics should avoid these entirely. Prioritize whole, fresh, ripe fruits, preferably with edible peels, well-washed. Beware of sugar-free labels on processed products. Many contain artificial sweeteners that, while not directly raising blood sugar, may alter gut microbiota and harm long-term metabolic control. Fruits are natural medicine, but only when consumed in their original form and proper context. Next, we'll discuss which fruits should be avoided or limited by elderly diabetics, even if natural. Fruits to avoid or limit. While many fruits benefit diabetics, not all are safe in large quantities, especially for the elderly with slower metabolisms and ongoing medications. Remember, the issue isn't the fruit itself but its high glycemic index, fructose load, or consumption method. Here are some to watch. Overripe bananas. The riper the banana, the higher its glycemic index. Opt for less ripe bananas and pair with protein or healthy fats. Mango, sweet and delicious but high in fructose. Limit to small portions, ideally paired with fiber. Grapes, small but tricky. Their sweetness and easy digestibility mean a high glycemic impact. Consume sparingly, preferably with skins. Watermelon, mostly water but has a high glycemic index. Limit quantity and pair with fiber. Dried/candied fruits. Raisins, dried apricots, and candied fruits are sugar concentrated. Even small portions can spike blood sugar. Avoid daily consumption. The rule: choose fiber-rich, less sweet fruits with edible peels. Whenever possible, consult a nutritionist for personalized guidance. Next, we'll show how to make fruits even safer with smart pairings for natural blood sugar balance. Smart pairings. For elderly diabetics, the secret to blood sugar control lies not just in food choices but in combinations that slow glucose absorption. Pairing fruits with fiber, protein, or healthy fat stabilizes blood sugar throughout the day. Here are practical, smart pairings. Pair with oat bran. Oat's soluble fiber forms a gut-slowing gel. Fresh plum with unsweetened plant yogurt, e.g., coconut/almond light, lactose-free, and anti-inflammatory. Baked apple with cinnamon and chia. Cinnamon modulates blood sugar, chia boosts satiety. Guava with pumpkin seeds, rich in zinc and plant protein, great for immunity and glycemic control. Fruit salad with mint and coconut flakes. Coconut's fats and herbs antioxidants aid glycemic response. These combos enhance nutritional value and make eating more enjoyable, key for elderly well-being. Consume these fruits slowly, well chewed, preferably as snacks separate from carb-heavy meals. Next, we'll explore the importance of timing and how it directly impacts blood sugar control. The right time to eat fruits. Knowing which fruits to eat is important. Knowing when to eat them matters even more, especially for elderly diabetics. The time of day affects how quickly sugar is absorbed, making it key to avoiding unwanted spikes. First tip: avoid fruits on an empty stomach, especially sweeter or low-fiber ones. Morning insulin sensitivity is higher, speeding sugar absorption. If eating fruit in the morning, pair it with protein or healthy fats. Another key point: mid-morning or afternoon snacks are often best tolerated. The body is already active, and digestion is more balanced. This also prevents long fasts, stabilizing daily blood sugar. What about dessert? Eating fruit after meals seems healthy, but if the meal was carb-heavy or large, adding fruit may overload digestion and spike blood sugar. If opting for fruit dessert, keep portions small and balance the rest of the meal. At night, lighter, low-glycemic fruits like apples or pears, paired with yogurt or nuts, are good options. Timing fruit intake to the body's rhythm is an effective way to control blood sugar without sacrificing enjoyment. Next, we'll address a common and serious question. Can fruits interfere with diabetes medication? Fruits and medication, can they interfere? A common concern among elderly diabetics is whether fruits can interfere with medications. The answer: yes, they can, especially with excess, poor pairings, or lack of guidance. Though natural, fruits contain compounds that may affect drug metabolism. Always plan consumption and inform your doctor or nutritionist. A classic example is grapefruit, uncommon in Brazil but popular elsewhere. It inhibits liver enzymes that metabolize many drugs, including diabetes meds, statins, and blood pressure pills. This can increase drug levels in the blood, worsening side effects. Other fruits, in large amounts, may destabilize blood sugar, altering the response to oral hypoglycemics or insulin. This can trigger hypo or hyperglycemia, especially without regular glucose monitoring. Timing matters too. Eating fruit too close to medication may alter drug absorption. Fiber and tannin-rich fruits, e.g., green bananas or thick-peeled apples, can delay pill absorption. The best strategy: maintain a stable, recorded eating routine and report changes to your healthcare provider. This allows safe medication adjustments. Next, we'll summarize key takeaways for safe, effective diabetes management in the elderly. Final tips: diabetes is serious, requiring constant care, especially in the elderly. But as we've seen, blood sugar control is possible with simple, safe, and tasty food choices. Fruits aren't villains. When chosen and consumed correctly, they become powerful allies in preventing complications, boosting immunity, and improving daily well-being. Key takeaways. Avoid extremes. Cutting all fruits deprives the body of essential nutrients. Choose low-glycemic, fiber-rich fruits. Apples, guavas, avocados, pears, and plums are excellent. Avoid juices and processed fruits. They lose fiber and concentrate sugar. Limit mangoes, grapes, ripe bananas, and dried fruits. Pair fruits with protein, healthy fats, or extra fiber to reduce glycemic impact. Timing matters. Snacks are safer than empty stomach or post-heavy meal consumption. Watch for medication interactions. Always inform your doctor of dietary changes. Listen to your body. Monitor reactions, keep up with checkups, and track blood sugar regularly. Now, we'd love to hear from you. Which of these fruits do you already eat daily? Any surprises? Share in the comments. If this content helped, like the video, share it with family and friends, and subscribe to the channel. Every week, we share health tips for living better, longer. Managing diabetes doesn't have to be complicated. With information, attention, and smart choices, quality of life is possible at any age.